So finally, the last part of today, standards. What is a standard? What are some examples of standards that you might see in everyday life? How and why are standards so critical to the credibility and safety of the cannabis marketplace? What impact do standards have on the global economy? And how do standards, specifically voluntary standards, become adopted into a marketplace? So I want to introduce you to ASTM International. As mentioned, I am the vice chair, volunteer. I'm elected. This is a volunteer labor of love role, along with 30,000 other global members participating from over 148 countries. Similar standards organizations, you may have heard of ISO, right? I mentioned them earlier. AOAC, I'll speak about briefly, and I'll reference in a bit. Underwriters Laboratories, UL marks on a lot of electronics. CE marks are common in Europe. There's all sorts of standards organizations for different products and product types. And ASTM is not just cannabis, right? They've been around since 1898 rather. Their first standard, fun fact, A1 on the T rails that make up the railroad rails, right? That was the first standard developed, and it's still in use today. It's gone through many revisions, as you can imagine, but that standard still exists and address the issues around product consistency, where trains were literally falling off railroad tracks. And what's the thickness? What's the width? What's the composition of the metal? What elements and alloys should be in there at what level to ensure that we have a reliable, safe transit system? That's just one basic example. Not to overwhelm you, but there is, of the 148 committees, there is a very amazing committee, F15, on consumer products. This was started and led by the need from the feds with the Consumer Product Safety Commission in the 1970s, and it covers everything from lighters, bathtub and shower structures, high chairs, carriages and strollers, cribs. Think about the details of what's the acceptable width between the bars on a crib that'll ensure that your infant will not fall out and injure itself, but also will not get their head in there and get stuck and choke, right? These are important life critical decisions that you need a broad spectrum of stakeholders, not just the commercial interest, right? But you need regulators, you need public safety advocates, you need consumers and users. And that's exactly what the ASTM process enables. Standards are everywhere. We take them for granted: the roads we drive on, the buildings we live in, our roofs. Look at a few examples, right? Even signage, colors, the universal signage, like the global harmonization requirements for chemicals. So regardless of what language you speak, you see a symbol on a truck, that goes back to something specific. Anybody that has kids or grandkids or has played with Crayola, who hasn't, if you look closely there, conforms to ASTM D4236. That is a foundational standard that Crayola and crayon manufacturers are required to meet to ensure that when your child accidentally chews on the crayon, because that's what a kid might do, that it's not going to be toxic and it's not going to injure them. This lip balm example, right? We've got, if you look closely, it says it meets to the sunscreen standard AS/NZS 2604-1998. Those are national standards between Australia and New Zealand that were created to ensure consistency of, SPF 30 and making claims. And then for folks that are familiar with those little tags that you take for granted on your on all of your clothing with those symbols, the symbology is an ASTM standard D5489. Essentially, think of standards not just standard reference material, but a way of doing things. They can be specifications. They can be practices or guides, like you should do these 7 steps in this order in order to create Y output. There are test methods. There's, again, specifications, classification. Standards have a wide variety of form and application. And to dive a bit further into the standards process, it meets the World Trade Organization's technical barriers to trade. That's what makes a truly credible and recognized voluntary consensus standard. And within Committee D37, we've got participation from nearly 1,000 volunteer members, we've got over 30 countries, Everybody here on the webinar is welcome and invited and able to become a member, which I'll talk about in a moment. But we've got over 50 approved cannabis standards. Those are making their way into regulations, into contracts as we speak. There's several countries that have adopted these standards, and there are several states that have adopted these standards. There's over 40 in development. There's we have 10 technical subcommittees now. The key here of this figure is the balance of interest. So the analogy I like to give folks when they start to understand why would I show up here, why would I engage in this process, is think about Boeing, McConnell Douglas, and the FAA, or BP and your gas stations, and so you got BP, the oil producer, or the gas producer. You've got a gas station, and you've got your state regulatory body, and you've got a consumer and an auto manufacturer. The producers, the BPs, the Sunocos, at the end of the day, they get one vote per company, and they cannot have more than 50% of the voting interest when going into adjudicating and creating a consensus standard, offset by the voting interest of users in general interest, everybody that does not have a commercial interest. And that's the power of the process to protecting public health and safety, because you cannot be dominated by commercial interests. Within Committee D37, developing these standards, we've got a whole host of technical subcommittees covering everything from the industrial aspects to the processing, lab testing, etc. Universal symbols, hemp seed and fiber, analytical preparation methods, security standards. One great example of where we don't have standards in our industry is a universal symbol. And think about consumer safety and how important it is for a consumer to see a package and understand at a basic level what's in this product. How's it going to make me feel? What concerns, what warnings should I be aware of? Without a standardized symbol, which through over 2 years of hard work, the volunteer members created a universal symbol, ASTM D8441, do a whole webinar on that. And we actually have 5 states that have either adopted the standard for packaging and labeling or are in the process of adopting them. A couple of other examples, we've actually just released, this is less than a month old, a standard specification. This is a beast. Label content. Think about the style, the format, the location, the prominence of the elements for a consumer product containing cannabinoid, whether it's adult use or medical use. For every state that exists, there is a different set of label requirements, a different symbol. How do we, establish the net contents? How much of the products are in there? Looking at medical flower, right? Should we have more the minor cannabinoids? Should we have this in a more quantifiable way? Should we have dosing? Should we have the terpenoids? Should we have use by dates? What about where is it? Cultivated by. Who do I call if I have questions? Who made this product? What's the 1-800 hotline? What if I have an adverse event? Who do I call? Who do I email? Those are basic things that should be on a package. And one final one I'll share briefly, which is also a beast. Want to give a thanks to the U.S. Pharmacopoeia and their cannabis expert panel for paving the way for a standard specification on medical cannabis inflorescence. Inflorescence, fancy way of saying flower. What is the phytochemical profile? What cannabinoids should be in there? What's the range, the acceptance criteria? Is 100 milligrams, 100 milligrams, or is 98 and 102 okay when the label says 100? What's that variance that's acceptable? What about cannabinoid? What about the terpenoids? What should those be reported as? What about microorganisms and mycotoxins? Moisture content, water activity. All these things should have established limits based on the route of administration. And then how do we define the different product types? So to kind of wrap up, being mindful of time here, this is the voluntary consensus standards process is a recognized process that also assists federal agencies. In 1995, Congress mandated through the National Technology Transfer and Advancement Act, another mouthful of acronyms, to require federal government agencies to use standards developed by voluntary consensus standards organizations whenever possible. And in fact, we have NIST, we have many state regulators, we have lots of other agencies, federal and state, internationally, Health Canada, et cetera, all at the table at D37 being part of that consumer, user, and general interests public health and safety overview body that's providing that check and balance to make sure that we have credible, safe standards. And there's also executive circular, OMB circular A119 that reinforces the goals of NTTAA, was updated in 2016 and discourages federal agencies from using government unique standards. So as you think about, as we work to try to harmonize this patchwork, the standards process creates that home, that safe space for us to work together and nerd out about the nuances between 1,000 CFUs and 10,000 CFUs of microbials, and what color, what shade of yellow should be on a universal symbol through a consensus vetted process. And in fact, these standards are used every day, and they are often referenced in the Federal Registrar. ASTM alone has about 3,000 standards listed in CFR for regulations and procurement, and there's a process for public comment, et cetera. Kind of wrapping up here, I want to give a big shout out. I work really close. I'm fortunate to work closely with the Cannabis Regulators Association through our government liaison subcommittee at ASTM, where again, I'm the vice chair for that committee. And we've been working closely with AOAC International on the testing standards and the US Pharmacopoeia, that's the 200-year-old health and safety organization, to assist regulators with understanding how these standards can work and how they can benefit their marketplace as we look towards federal legalization. And with that, I'll like to say, come get involved. Anybody can become a voting member. It's literally $75 a year, and it's open to all. You can go to astm.org, follow the process, read about membership. You can attend and participate in committee weeks. Come in June, next week, actually. If you've got nothing to do and you've got plans, or you live in Denver, come to our in-person meeting. It's free and open to all, even if you aren't a member. You need a little more plan to attend, come in January. And you can access all future meetings, including workshops here. And then these are just some resources that I personally have on my bookshelf behind me that might be useful to keep yourself involved and understand the good, bad, and ugly and complexities of the cannabis product. And then to wrap up, GMPs are truly the bare minimum, including for cannabis. Standards are an incredibly valuable tool, and we as stakeholders, whether we're public health defenders, whether we're consumers, whether we're advocates, or just interested people that know somebody, come roll up your sleeves and get involved with us. We really value your support in creating GMPs for cannabis and all the other standards that we're needing.